Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about maintaining patient satisfaction without compromising patient quality of care. Nowadays, it seems like it's harder to keep patients satisfied, and I would attribute that to multiple different things, and I don't want to get into that right now. However, in order for you to be successful in your practice, word of mouth is very important, as well as the reviews people put about your practice on social media and the internet. Patient satisfaction can make or break you in any business right now, actually, client satisfaction, customer satisfaction. But because we work in medicine, patient satisfaction is what we focus on. Unfortunately, a lot of patient satisfaction nowadays is based on if patients feel like they are getting a bang for their buck because healthcare has gotten so expensive, but they also want fast solutions. And unfortunately, that is not the reality of most medicine, right? There are things that take time, and it also takes participation and willingness on the patient side in order to have some successful outcomes. This is just the reality of where we're at right now, and if patients don't get the outcomes that they're looking for within the time frame that they expect, they can become disgruntled. They also are quite sensitive to hearing certain things and get defensive, and that can decrease your patient satisfaction scores as well. I have been in healthcare a really long time, and I have seen the paper charting side of everything switch into the electronic charting. One of the biggest things patients had a complaint about or a dissatisfaction remark about was that they felt they weren't being listened to when we switched to electronic medical records. They felt like the provider was more focused on their computer screen and typing and things like that than actively listening to them and their concerns. That's my number one recommendation to satisfy patient satisfaction is to be a true, engaged, active listener. I took communication courses in college, and they were very, very beneficial that I use in my private life and in my business life, because being an active listener, number one, is huge. People like to feel like you are engaged and you're hearing what they are saying. The other thing is your body language. We communicate majority of our communication every day by our body language, how our legs and arms are crossed or uncrossed, the expressions on our face, the movement of our hands, things like that. If a provider is engaged on their computer and they are just staring at the computer, they're not making eye contact with the patient, they don't seem like they understand what's being said, they're not repeating things, they're not reiterating or asking questions, following up on what was shared with them by the patient, patients become very upset, and rightfully so. So my number one recommendation is to find a way to make sure you're still able to give the patient your full undivided attention with occasional making of notes instead of just constantly typing. Following up on that and that whole communication piece is putting the why behind things that you're doing. If you're ordering tests, if you're ordering lab work, if you suggest a treatment or a medication or an exercise, provide the why behind it and the goal of doing it. Don't just tell them this is what we're going to do, but actually explain the why behind it. Kind of like your kids, right? Or children. You can tell them what to do, but when they're at a certain age, why? I'm a why person. I'm not going to lie. I will be asking further questions until I feel like all my questions have been answered and I am satisfied with the information I was given so I can make an informed consent. Again, in medicine, informed consent is huge, and putting the why behind it is the number one reason. Another tip for communication is not to be too technical with your medical jargon when you're explaining the why or you're giving an explanation of what your findings are. You have to use plain terminology. You need to know your audience. You need to see that if they have a blank look on their face or they're looking around, either they're bored, they don't understand what you're saying, but then you need to follow up with some kind of communication going, do you have any questions? Are you understanding what I'm saying? Did I lose you? It looks like you're not understanding or following what I'm saying. Where can I go back to help you understand? You need to show them that you're noticing that they are having a hard time following. And it could be because you're being too technical. You're using too big of words. You're scaring them. You're making them feel more anxious. You have to read them and you have to be good at it. Another way to help with patient satisfaction without compromising quality patient care is providing expectations to patients the moment they come onto your service. This is really important, especially for primary care or people who will be managing chronic conditions for patients. Patients need to know where there's a line in the sand going to be drawn between the provider, the doctor asking the opinions and the input from patients versus this is what needs to be done in order to get here, right? There has to be a line in the sand. Of course, patients always have a choice whether they want to follow the treatment plan or not. However, you do have to set those boundaries and those expectations from the very beginning. You can't come in halfway through and try to do it because that is where you're going to upset patients. But being upfront and explaining everything from the very beginning and being consistent and holding to it is going to help you gain respect from the patient, and they'll also respect that. If after seeing you for the first time, they don't like it, they won't continue to see you, but at least you can say that you communicated it to them. The other thing your staff can do is be upfront with patients when they check in. The doctor's running behind. I really apologize. If we need to reschedule, we can. However, it's going to be about this much time before we get you roomed, or it's going to be about this much time until we are able to see you. Something like that. Don't try to hide from it. It's a tough conversation to have, but patients prefer you to be honest with them from the beginning than to just keep up making things up and avoiding that conversation. If patients are calling the office and they're expecting a call back, make sure your recordings, your auto responses, the staff at the front desk all make it clear. You can expect a follow-up phone call from our staff within 24 hours or 48 hours or something like that. Don't give vague guidelines. Don't give vague timeframes. Be very specific, and you have to hold to it unless, of course, there is an emergency. Also, having those follow-up conversations with patients after certain visits or after certain interactions with your practice by a text message, a phone call, a portal message, something to let them know that you care and you understand that something heavy was discussed with them, or they're starting a new treatment, or they might have more questions after they leave or something like that. You follow up with that information and outgoing expectation that you want them to give you feedback, and they will like that. Involving patients in decisions is something that a lot of patients appreciate. And you might not agree with what they want to do, and they might not agree with what you want to do, but hopefully by having the discussion, there's some middle ground that can be found, or someone will see the other person's side and you will try that approach first before possibly moving to something else if it doesn't work, or you convince the patient why their opinions or their concerns are not really going to be affected, or whatever it might be, and they will come on board with you. But you have to be willing to have the discussion with them and have them involved in the decision. Give them options. Maybe you can give them all options that are good, just some are better than others, and you communicate that to them and let them decide what they feel is best for them to start trying first. Or if you've tried something already, telling them what the next step would be. If there's no other choice there, then you tell them that, but at least you would have that back and forth dialogue. I am a very visual person. I need visual aids a lot of times, or I need to get my hands on something to understand it if I have to repeat it over and over. And that is how I have learned a lot of other people are as well. They're not just auditory learners, they're actually auditory and visual learners. So if you can bring any aids, references in with you to have heavy discussions, make drawings, whatever it is, to help them better understand what you're discussing, it's only going to benefit you, and they will feel like you actually took the time and that you care. And that's going to help with patient satisfaction. Patients can detect when providers are rushed, when they feel like they're being hurried in and out, and that is terrible. I have had that feeling myself as a patient, and it is not comforting whatsoever. They can tell that you're not giving them the amount of time that they are due, and it will definitely lower your satisfaction scores with patients and word of mouth of people not recommending you if you're constantly running behind and also making them feel like you're trying to get caught up during their visit. If you're running behind, oh well, you still need to give them the same feeling you give every other patient, that you're giving them what they need and you're not hurrying through anything and you're not making them feel rushed. If you find yourself constantly running behind, why? Are you having too many personal side conversations with patients? Because I was a medical assistant for a doctor who did that. And I would have to go knock on the door and say, your next patient's ready. And the patients would always be like, uh-oh, we're in trouble, because they knew. They had been seeing him forever. They loved him because of it. And he was a wonderful provider because of that. However, it did upset a lot of patients who were on a schedule. Maybe they were there during their lunch break. Maybe they had to go pick up a child from school. And it did get frustrating once in a while. And I kind of had to, quote, babysit and knock on the door and say, hey, your next one's ready. Hey, your next one's ready. Or I would just come in and be like, okay, I'm going to draw your blood. The doctor's going to go see the next patient. I had to start doing that because he wouldn't get out of his own way. But then he started learning how to delegate tasks a little bit better. So he would, when I knock on the door, go, oh, we're going to do an ear flush, or we're going to draw some blood, or we're going to give a vaccine. So I knew I would go get the stuff, and that was his way out of the room with a talker, so that he could be like, okay, Jen's here to draw your blood. I'll see you later. We'll be in touch with your follow-up information. And then he would get out. So being a provider and kind of knowing your ins and outs and communicating to your staff, delegating your staff to do certain things to allow you to have more time is super important. The last thing I want to talk about when it comes to patient satisfaction is obtaining the patient satisfaction results. Send out surveys, whether it's through your portal or maybe you can do text messages. Look and see what people are saying about you on social media. Look at your Google reviews, your Yelp reviews, things like that. Measure, evaluate, analyze, and see if there's any areas where you have opportunities to improve. We all do, and taking that candid feedback sometimes can be very, very helpful. It also shows patients, if you're sending out those surveys after they're seen, that you do consider and care about how they feel after they leave your office, whether they saw you, they saw a staff member, something like that, that you will take it into consideration. And that will also drive and increase patient satisfaction, but also their confidence in seeing you and your staff as well. My last suggestion that I think goes really far in a practice, especially if you see the same patients over and over, is to encourage your staff to get personal to the point where they can greet the patient by name when they see them walk in the door. That they can ask little follow-up questions on, oh, how is your son doing after he was sick? Because maybe they're a patient as well. Or how was your trip the last time you were leaving for Hawaii? How did it go? Not getting super overly personal, but enough that they know that they're not just a number, that they're not just a patient, that they're a human, and that there's that human interaction. Patients love that, and they miss that a lot with all this institutionalized medicine that we've gone to in this country. Now that the pendulum is swinging back to private practice and you can have more of that relationship with patients, not only providers, but the staff should as well, because that is definitely going to help your patients want to come into your office when they need to. They're going to speak highly about you to their friends and family, and it makes you feel good that they are trusting you with their care, not only for themselves, but if they bring loved ones in as well. Patient care and quality of care with patient satisfaction goes hand in hand. And I hope that you realize that during the video today, that you can have quality patient care and also keep patients satisfied if you're mindful of it, if you practice some of the things we discussed today, and it's something that you're striving for to improve all the time. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all your colleagues whom you feel would benefit. Thank you so much, and we will see you next time. Bye-bye.